everybody on the internet, if you're famous or a celebrity, seems to have. And I guess that is achieved through what's called rib remodeling.
Correct. So I think to start with rib remodeling, we should start to talk about what it's not.
Okay.
It's not removing any ribs. Okay, we're not taking anything out. There is no incision. So I think there's a lot of stuff on social media, girls holding a bag of ribs.
Yes.
I'm sure those were baby back ribs from Chili's, is my guess. But so we're not removing any ribs. We're taking a very small, special, like very precise instrument and just tapping on the ribs, and then we're folding the ribs. So the ribs kind of have this look like this, and then once we do the bending, they start to come in like this so that your waist also comes in. So there's virtually no scars. It looks like a little freckle when it heals. And then you have to be in a corset. So you're, again, doing lipo, BBL, usually you have to be in a faja. That's that compressive kind of wear that they put on. And then a corset goes on. And that corset over 3 months helps mold the ribs to a more acute angle so that the waist looks more cinched.
And immediately when you say this, what comes to mind is Khloe Kardashian, Kylie, Cardi B.
Right.
I mean, even people like Meg Thee Stallion look super snatched.
I'm not their surgeon, but maybe there is some rib remodeling there. But back in those days, like, this is kind of new. Rib remodeling is very on the cusp. I think, there's only a handful of us that do it in the US. So they may have had some removed. Now, some surgeons do remove the ribs, although it's pretty rare these days because the ribs are there for kind of a reason, right? To kind of protect your kidneys, protect your internal organs. So that's why we love the rib remodel technique, because they're still there. They're just kind of folded in a more acute and cinched look.
How do you fold them? Like, so you're not like shaving down the ribs?
No, I'm not shaving them, but we use a special little instrument that looks like a needle. And then the rib sits like this inside, and we just tap on the rib like this, and then it folds.
Oh, my.
And then it folds the waist in.
So is this, after being pregnant, like your ribs?
This is,
Yeah.
This is a good point. So when patients get pregnant, I always tell patients, like, hey, if you're interested in rib remodel, if you're thinking about getting pregnant, this can maybe undo it. Because when the baby gets larger and larger and the tummy's getting a little bit bigger, the ribs can start to flare back. And the baby's there for 9 months usually, so those ribs can remodel back. So we get a lot of patients who come to us who've had children are like, hey, I didn't used to have like this SpongeBob look that people say they have, a very square look. Is there something we can do? Because I think a lot of patients get confused and are like, well, why don't you just lipo all this to make it cinched? And I'm like, well, that's just your rib. There is no fat there. It's actually just your rib cage is wide, and the only thing that can help you is to try and fold or remodel the ribs.
Wow. And so then post-op, that's when you would wear one of those.
Yeah, the corset comes in
things.
And you kind of have to tighten it. I put you in it, and over, a 3-month period, I'm sure you saw some video here, we always measure someone. And on average, we get 2 to 3 inches off someone's waist. But at the most we've seen is 7 inches. Yeah.
Wow. Now, is there any risk to damaging, like if your ribs are squishing in, what's that doing to your insides?
Yeah. No, I think, again, the ribs are kind of, there's muscle around them. There's a lot of things that are protecting your organs. But there's a few risks. I think, like, everyone's like worried about their lungs. Like, I have a friend who was in a car accident and broke their ribs. And we have to remember that the ribs that we're going after are the ones way at the bottom. Okay, 12, 11, and 10 are the ribs that we usually target. And those ribs are not really by the lungs. So the lungs are much higher. They start around the 10th rib. So, but this instrument that we use is, like I said, so fine that even if I was to go into the lung, it's very, very rare to have some kind of, we call like a pneumothorax or something like that. But that's a rare, it's never happened to me, but a very rare event.
Is there anyone that's not a candidate for rib remodeling?
So as we get older, bone density starts to get less and less. So we try to keep patients who are under 50. Okay, so when patients start to get over that, there's been studies to prove that the bone density starts to get less and less. And again, the folding, we want these to heal in their new position. If there's not, the bone density isn't there, then it's not a great idea.
I always wonder the psychological component to all of this, because obviously you have to have a conversation with the patient, which is more in depth in terms of the realistic results that would possibly make them feel better or worse, because I'm sure they might be thinking, okay, if my stomach was just like this, I'll feel more confident or better. And they don't get it right away because the recovery is a process in itself.
So the recovery is an emotional roller coaster, right? So it's important, and that's why I give all my patients like my cell phone. Like there are times when I think patients kind of get, not feeling so great emotionally, and they're like, I'm still swollen, my tummy. And it's only been a couple weeks. It's Jung always says trust the process, and that's what we try to tell our patients as well. Is that but you got to be there for them, because I think can be emotionally taxing. Like, hey, this isn't. But then I get the text at 3 months, and like, oh, my etch is starting to come in, or look at my waist. Like, look, now I measured it and I lost 4 inches, and it's tough. But I think, with our help and with our staff at Premier Surgical Arts, like we get a lot of patients through it.
How big of a component is diet and healthy lifestyle? Because I know when we are looking at these celebrities who have these dream bodies, I would imagine they're also eating well and like working out. How big of a role does that play in?
The biggest role, I think patients, they're like, oh, they're like, the prices are so high, but like we see them often and we're checking in after them. But it's so important, number one, like we always harp on salt. Like, okay, it's hidden in everything. Okay, we've had some soup. I'm like, okay, that's probably, so, and then keeping high protein, low carb, like we just want patients. And I think after you get the surgery, patients are excited. Like they're like, oh, I've never eaten, I've never looked like this. And they're looking in the mirror like, I've never had abs, I've never had this body. And it excites them and it gets them motivated to stay. But it's so many things, because you have to wear the faja, you have to do the massages, you have to, it's not just, pay the bill and like
you're done.
You're done. No,
it's like you have to put in the work too.
Yeah, they have to put in the work, because we've seen when patients are like, oh, they come in, they're like not in their faja, they're not doing compression, not doing massages. I'm like,
oh boy,
why didn't we just burn the money? We can only do so much, but
and then it's your responsibility to take care of your body. That's such a good point. I mean, I hurt my wrist 2 weeks ago, and I was like in a depressed hole because it takes so long to heal. So I can only imagine something like that must take so long. But this was taxing. So informative. And for everyone watching, this is what celebrities are doing, even coming to Houston to get this done. So just remember that when you're scrolling on social media, that there's like this whole world of rib remodeling and Dominican tummy tucks.
Love how Caroline's like rib remodeling.
I know, like, ooh, no. Thank you so much, Dr. Erickson, for explaining all this to us. We love this stuff.
Yes, it's just fascinating because we see it on social media and people want to know more about it.
So come back anytime. The next time some viral crazy thing comes up, I'm giving you a call.
I'll be here.
Thank you so much. And thank you guys for watching. And I can't believe Taylor Swift and Travis Kelce are engaged.
I know.
She's a bride like me.
Yes.
All right, bye, friends.
Bye.